Hi, welcome everyone. We're joined today by Cary Breese, the CEO and the founder of NowRx. Cary, thanks for being with us. How are you doing?
Doing great. Really thank you for having me today.
Absolutely. Really excited to be talking about how providing that free same day delivery, the better pharmacy experience, is about more than just the delivery logistics, NowRx and their mission and what you guys are doing for this. So let's start with a couple of things that we need to learn from you. The bad experiences in pharmacies are usually coming from bottlenecks, which are usually the result of breakdowns in the back end of the pharmacy, according to you. What is NowRx doing to fix these kinds of problems?
Yeah, a lot of issues happen inside the pharmacy before you even make the trip to the pharmacy. So you can have miscommunications with insurance companies that may deny the payment for your medication. You could have lack of coordination or poor coordination with your prescribing physician, maybe regarding refill authorization, or the prescription itself may need clarification. There are inventory management issues, a lot of manual processes in today's kind of traditional pharmacy. And so what NowRx does is we've rebuilt a modern pharmacy solution using the latest in AI and software technologies, as well as robotics and other automation, to just make a completely seamless experience for patients. So they get a prescription they from their doctor rather than going to a pharmacy and waiting in line and fighting with their insurance company. With NowRx, they can go about their day. They can go home. They can go to work and know that that prescription has been processed seamlessly. The coordination's been done with their insurance company using our software and their physician in an automated way. So they get a prescription that shows up in 3 or 4 hours, delivered right to them, no hassle, completely seamless experience, just a better pharmacy.
That's terrific. And then I mentioned this kind of leading into this, right? And this will be kind of a segue off of your point. But diving deeper into what you just said, the poor pharmacy experience, again, can result from something as simple as an order bottleneck behind the counter. So pharmacy delivery hasn't necessarily improved that experience, especially for the consumers. But how does NowRx work to minimize those bottlenecks specifically?
Yeah, you really have to crawl inside the inner workings of pharmacy. And, there's something called a pharmacy management system. It's a big software system like an ERP software system that runs every pharmacy in the country. And that technology, that software platform, does an awful lot. It communicates with insurance companies. So when you present your card at your pharmacy, it sends a message out to your insurance company and usually get a code back from the insurance company saying, hey, this claim's confirmed or denied, or here's an error code. Well, in our software, in our pharmacy management system that we created from scratch, our software actually takes those error messages and those communications from the insurance company and solves many of the issues that hang up at traditional pharmacies. And same is true with communication to your physician. There's a communication pathway between pharmacy management systems and physicians' EMR systems, or electronic medical systems that hold all your records. And so that communication oftentimes is very poor. And again, our software has a very automated and intelligent way to communicate, get in front of those refill authorizations, fix any clarifications with your doctor without a human having to pick up the phone, make a call to your doctor, usually while you're standing in line at the pharmacy and waiting for that technician behind the counter to call either the insurance company and stay on hold for an hour, or the physician. So our software program that we've developed, it's a pharmacy management system with a modern technology using a lot of AI and machine learning to fix a lot of these communications and make it a completely seamless process for the patient. So even if you add delivery to a pharmacy, if your insurance company doesn't pay for that medication, it doesn't really matter. They're not going to be able to deliver it to you because you're not going to want it. And so you can't fix pharmacy just by adding delivery. You actually have to fix the processing that goes on inside. And that's what the NowRx software does.
Awesome. Really, really interesting. Now, can you go into a little bit more detail about how NowRx uses the intelligent automation to improve that pharmacy experience?
Yeah, we have detailed analytics and machine learning algorithms and other software automation to handle all of those communications, error handling, provide decision support systems for the pharmacist and the technician, all of that software. It's quite comprehensive. We've also built in our own logistics platform that is integrated with the pharmacy processing. So we can expose to the patient and our user app the point in the process where the prescription is at any point in time. We can flag any errors when they come up with insurance or physician processing or inventory management or delivery. all of that's coordinated in one comprehensive pharmacy management system. We call ours NowRx Quickfill. It's called Quickfill. We're on V3 right now, and we think it's the most modern pharmacy management system in the industry today.
And then obviously NowRx already has great customer reviews. You guys have an outstanding track record already early on, clearly impressive, but it supports everything you just touched on. So pivoting and then zooming out a bit to a bit of a larger scale picture, can you talk about what's next for NowRx and what the milestones for the audience should be looking out for?
Of course, yeah. We recently launched something we're really excited about, which is the NowRx telehealth platform, where not only do we provide free same-day prescription delivery, and again, that very seamless pharmacy experience for our users using our software, but we also can uh, connect any patient with a physician in our portal, in our telehealth portal. So a patient can be at home in their pajamas, interacting with their physician on the NowRx telehealth platform, get their care that they're accustomed to. If a prescription is ordered as part of that interaction with a physician, then that prescription gets routed to the nearest NowRx fulfillment center, and that patient can have that prescription delivered right to their home while they're sitting at home in their pajamas, and have that delivered free of charge. So we are expanding NowRx to have a complete integrated healthcare platform to bring just seamless care to not only prescription delivery, but also healthcare at large. We have other things that we're developing too to expand our services around something called specialty pharmacy, more complex medications that are more for cancer patients and hepatitis and things like that. Take a little more care, a little more interaction from the pharmacy. So we're expanding in that direction as well. And so we are expanding the company nationwide with both our delivery pharmacy, our telehealth, and soon specialty pharmacy. And we think that we're a great opportunity for an IPO company in several years, and that's what we're trying to build.
Great. Excited to watch the future there. Cary Breese, CEO and founder of NowRx. A lot of potential in the future. Looking forward to seeing that come together. We'll talk to you soon.
Thank you.